Melanie is a 17-year-old girl who has had an intake with a family health team and is meeting with her family doctor, Dr. Amos.
Hi, Melanie. Thanks for coming in today. It's nice to see you again. How have you been?
I've been okay, thank you.
I'm glad to hear you're okay. Before we start, I'd like to give you some information about the session today. Even though we're meeting virtually, it's very similar to when we meet in person. Everything that you share with me is confidential. The only exception is if there's an immediate concern regarding safety. That might be an immediate risk to yourself or to somebody else. In that case, I might need to share your information. This could be a referral to the emergency room or to get in touch with somebody who knows you really well. Before I get in touch with somebody, I would let you know. Does this make sense so far?
Yeah, absolutely.
Okay, good. I'd also like to let you know that we're meeting over an encrypted video conferencing system. Even though the system is encrypted, we don't have the same control over privacy as if you come in and I can close the door to my office. Are you okay to proceed?
Yeah.
Okay, so what brings you in today?
I need a note for my exam.
Can you tell me why you need the note?
Yeah, I haven't been feeling well lately. I haven't been sleeping much and I don't have much energy.
I'm sorry to hear you haven't been sleeping well. Has that been affecting your schoolwork?
Yeah, I've been more distracted.
Okay, can I ask you some more about how you've been feeling?
Yeah.
What would you say your mood is like most of the time?
Stressed, kind of, and annoyed. I've been feeling this way for a few months now, but it feels like it's been longer.
So you've been feeling stressed and annoyed for a few months now. Have you been able to do the things that you normally do?
When I'm not in school, I'm usually in bed on Netflix. I just want things to feel better again.
Melanie, would you say that you've lost interest or are getting less pleasure from many of the things that you usually enjoy?
Not as much. I just, I don't feel like I enjoy the things as much as I used to. I still like my friends. It's just not as much fun to go out with them anymore.
I'm sorry to hear that. Do you also feel like your thoughts are more negative or you're feeling down about yourself a lot of the time?
Not really. I just feel like I want things to be the way they used to be. I feel like I'm disappointing my friends and family all the time.
Sometimes when people are feeling really negative about themselves, they can also start to think things like they wish they weren't around. Have you been having these kinds of thoughts?
No, I haven't.
Melanie, have you been having any thoughts about wanting to end your life?
No.
Sometimes when people are feeling down, they may want to cause pain or injury to themselves without meaning to end their life. Have you ever deliberately harmed yourself in some way?
No.
It can be really hard to talk about these things, so thank you for your openness with me. I'd like to ask a few more questions to better understand how things have been going recently, and then we can talk about what might be helpful, including a note for school.
Okay, thank you.
Dr. Amos continues the assessment, asking additional questions. Melanie completes the Mood and Feelings questionnaire to get a quantitative measure of depression symptoms. Dr. Amos expresses that she thinks a diagnosis of major depressive disorder may explain Melanie's symptoms and that there are treatments that can help. She gives Melanie a note for school and they discuss the treatment pathway for youth with moderate to severe depression in the Cundill Centre online tool for the treatment of youth depression.